The listening part of the occupational English test has 3 parts, and in each part you hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You have time to read the questions before you hear the extracts. You will hear each extract once only. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check your answers. Part A. In this part of the test, you hear 2 different extracts. In each extract, a health professional is talking to her patient. For questions 1 to 24, complete the notes with the information you hear. Now look at the notes for extract 1. Extract 1, questions 1 to 12. You now have 30 seconds to look at the notes.
It up onto the computer later on. Okay. So just in your own words, tell me what's brought you in today.
Well, I've been getting some diarrhoea, really. Yeah, for the last sort of, 2 or 3 weeks.
Okay, so before 2 or 3 weeks, no problems really?
So before that, no. I mean, I've just been going normally, which is once every couple of days or something. Yeah, no problems normally.
Okay, so just tell me a little bit more about the diarrhoea, what it's like and things like that.
So like what my poo looks like, sort of thing. Okay, so it's quite it's runnier, sort of looser than normal. I don't think there's any change in like colour or anything. And I'm probably, but I'm just going a lot more often.
Can I just check? Do you have any blood in it at all?
Oh, gosh, yes. I'm surprised I haven't said that already. It's worrying me. That I've had for a couple of days.
And is it difficult to flush away at all?
No, it's not difficult to flush away.
Yeah, and do you ever see any food that's not digested properly in it?
No, that wouldn't be something. No. No.
So you said diarrhoea, but how many times a day does it actually happen?
Well, I would say somewhere between. Well, at the moment, probably somewhere like yesterday was probably about 8 times.
8 times, dear.
I mean, I don't think it's been like that every day for the last 3 weeks, but
up to 8 times a day.
8 times,
Do you have to get up at night to go to the toilet?
Yes, yeah.
Oh dear.
Yeah, and I've never had to do that before.
And you're losing sleep over it?
Oh, yeah.
And do you have any tummy pain at all?
Yes, it's quite sort of crampy, mainly just before I go to the toilet, but it can be at other times.
But then does that pain go away once you've been to the toilet?
Yeah, a little bit. Yeah, I would say so. A little bit.
And does anything make the pain worse at all?
Just eating. I can really think of.
And you pointed to your tummy. Exactly where is it?
It is just sort of around the middle, really.
Yeah. And how do you describe that pain?
It's sort of crampy.
Crampy is what you said, isn't it? Yeah. And how bad is it? If 10 was excruciating and 1 was very little pain, then where would you put it?
It's not. I've had worse. So probably about 4.
Yeah. So it's not agonising, but it certainly is there.
Yeah.
Okay. And you've told me about when it comes on and what makes it a little bit better and worse as well, which is good. So I'm just going to ask the rest of the questions just about the whole gut itself. Do you have any difficulty chewing your food at all?
Oh, no.
No mouth ulcers or anything like that?
No.
Any difficulty swallowing your food at all? Do you ever get indigestion?
No.
Not really?
Well, sometimes, maybe on a weekend. Sometimes.
Okay, but not usually.
No, not usually.
So this was only about 3 weeks ago. 3 weeks ago that you've had the problem.
Yes.
Okay. And prior to that, what was your bowel habit like?
I don't go that often, really. It's sort of maybe once a day, once every 2 days.
Once a day, once every 2 days, but certainly no diarrhea.
Oh no.
A normal form stool.
No, it's quite harder. If anything.
But no blood, not black at all.
No.
Okay, that's great. Thank you very much for that. On to your past medical history. Any operations in the past at all?
Yeah, I did when I was sort of in my teens. Probably, I think I was about 15. I had my appendix removed.
In your teens, okay,
Yeah,
but nothing since then. No big
no.
operation since then.
No.
Okay. You said that you take a little bit of paracetamol for your headaches.
Yes. Yeah.
Okay. And are you doing any of the medicines at all?
Just the pill. Yeah. No, nothing else.
Nothing else at all. Okay. And nothing else over the counter.
No, just paracetamol for my headache.
Recreational drugs at all?
No.
Okay. And are you allergic to anything?
Oh, yes. I'm allergic to amoxicillin. So is that penicillin?
Yeah.
So we're allergic to penicillin.
Okay. What happens when you have penicillin?
Oh, that's what I get. That's when talk about a rash. I get a rash.
Oh, I see. So that's the rash.
Well, no, but yeah.
Yeah. Okay. So rash with penicillin. So who's with you at home?
So I live with my partner, Sam.
Okay. No particular problems there at all?
No.
Okay.
We've been about 3 years.
Is there any family history of note?
No, not that I'm aware of anyway.
No gut conditions in the family?
My aunt maybe. My aunt had something to do with her tummy, but I don't know what it was really.
Okay.
It wasn't cancer.
So just moving towards the end, I just wanted to explore your ideas, concerns and expectations really. So what do you think is going on with this problem?
Well, I think it could be an infection.
An infection, yeah. And you told me about one of your concerns about passing it on to people at work, and especially the children, I guess. Yeah. But any other concerns?
They pass on to me.
Yes.
My sister, my friend's sister, has got bowel cancer. She's only 30.
Oh dear.
And so it's just the bleeding, really, more than anything that's worried me. So I wondered about that, really.
I mean, I'm glad you told me that. We'll try and reassure you, and let's see what turns out in your case. What do you think we need to do today to help you?
Well, I wondered if I might need some tests. I mean, I'm really hoping, because I did have a little look on the internet, and I'm really hoping it's not going to be one of the cameras. I think it's colonoscopy or something like that. I'm hoping I don't have to have that.
Sure. Okay, I think I've got everything there. Is there anything else that you want to tell me? Actually, I've just remembered. I forgot to ask you about travel. Have you had any travel in the last few months or weeks even?
No, I haven't been away anywhere.
Okay,
no.
And you can't distinctly say that this is due to a particular food that you've had, and nobody else has had this problem in your family?
No.
Just wanted to check that.
Yeah.
Okay, so is there anything else that you want to tell me about this problem?
No, I did go travelling about 3 years ago to Africa.
All right, 3 years ago.
Yeah.
Okay.
I went to South Africa and up into Zimbabwe.
But were you well there though?
Yeah, I was well. Yeah.
Okay. And do you have any questions for me?
No. How likely is it that I'm going to have a camera?
Well, I think initially we'll probably run some blood tests and do the stool sample, and make sure there's no infection. Then I probably need to get a gut specialist to have a look at you if it hasn't got better in a matter of weeks.
For questions 13 to 24, complete the following notes with a word or short phrase. You now have 30 seconds to look at the notes.
Come in.
Hi, Ms. Jones.
Yes.
I'm Jane Crone. I'm a medical student with the university
Nice
here.
to meet you.
I've been sent in by Dr. Smith as part of our training as a medical student to do an interview with you.
Okay.
And then I'll take that information back to Dr. Smith, and then she will come back in and see you then after that.
Okay.
All right. How may I address you?
Mrs. Jones is fine.
All right. Thank you. Is that okay with you today to talk?
Yes, that would be fine.
Thank you. I'm going to start out today by just talking a little bit with you about your chief complaint. What brings you here today?
Sure. My left elbow has actually been bugging me a lot. Every once in a while I've been getting a little bit of pain, extending my arm and going back to bending it. Really, that's the primary reason I've come in. I've attempted to take a little bit of Tylenol to relieve the pain, but it's not really seeming to help much.
Okay. Before we talk a bit more about that, is there anything else that you want to talk with either me or Dr. Smith today?
Not that I can think of, no.
Okay. Tell me more about this pain.
It's just kind of a throbbing pain. It'll act up kind of randomly throughout the day. It's not specific to, the morning or evening or even in the middle of the day or night. It just kind of randomly acts up. I would say excessively, like when I'm doing work, like after the dishes. It'll start to act up. If I, lift one of my children up, it'll start to act up. So any sort of exertion is kind of where I've noticed a lot of the pain coming from.
And tell me, when did it start for you?
I would say in the area about maybe a week and a half to 2 weeks ago.
Okay. And you described the pain as throbbing. Is there anything else about the pain in terms of the quality of the pain that you want to describe for me?
No, just really throbbing.
Okay. Started about a week to 2 weeks ago. Okay. And do you recall what you were doing at the time that it started?
I've been helping my husband clean out the garage lately, and we were lifting some boxes. And that's kind of, I didn't notice it at the moment, but later in the evening it started to act up.
Okay. I would like to hear about a little bit about the severity of it on a pain scale of 1 to 10, 10 being the worst pain you've ever had, 1 or 0 being no pain. How bad is this pain?
I would measure it probably about a 6 or 7.
6 or 7?
It's become more of a nuisance than an actual physical pain.
Okay. And is it a 6 or 7 all the time?
Whenever it starts to act up, yes.
Okay. And how often a day does that happen?
I would say maybe 2 to 3 times per day.
Do you notice any pattern to that at all?
No.
Okay. All righty. And can you point exactly to where it is for me, the location of it exactly?
Kind of the area that just kind of wraps around the actual elbow.
Okay.
That is really bothering me.
And does that pain go up your arm or down your arm or anywhere else on your arm?
No, it stays right in that area.
Okay. Is there anything else that goes on at the same time? Any other symptoms that happen? Anything else other than when the pain is happening there? Anything else going on for you?
Not that I've noticed, no.
Okay. All righty. Is there anything that makes it feel better?
Nothing that completely gets rid of it. Tylenol will relieve it for a temporary period of time, but it hasn't gotten rid of it.
Okay. And how much Tylenol do you take?
Whatever it says on the bottle, usually 1 to 2 tablets.
And is that regular strength or extra strength?
Regular strength.
Okay. And you just take it across the counter, the normal directions on the bottle? Okay. Does anything make it worse?
Like I mentioned, any sort of exertion, picking up a child, doing the dishes, pretty much daily kind of living activities.
So using it?
Yes.
Okay. All right. Have you seen anybody else for this complaint?
No.
What else have you tried other than the Tylenol and anything else other than the Tylenol?
I've attempted to use a heating pad on it, and I've also attempted ice. Neither were successful.
Okay. It sounds you've talked a little bit about how it's impacted, you to be able to work in the garage or do the dishes or lift your child. Is there other impact on your life?
Like I mentioned, it's just more of a nuisance. There will be times in the middle of the night that it'll start to act up. If I get up to go to the bathroom, I'll notice pain in my elbow.
Does it wake you at night?
It doesn't, but if I wake up in the middle of the night, it will trouble me in falling back asleep.
Okay. What do you think it is?
I'm not quite sure. My best guess is maybe some sort of pulled muscle or something.
Okay.
But honestly, I don't know.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen.
You hear an ED nurse talking to the relative of a patient who has been recently admitted.
Did you want to talk to me, Miss Tanaka?
Oh, yes, you see, I just wanted to let you know that my father, well, as you know, he's recently been diagnosed with dementia. Most of the time it's not an issue and his spats never last long. It's just that I wanted to prepare you. Sometimes he's really not himself.
Ah, okay, Miss Tanaka. I think I understand. Can your father become aggressive?
Yes.
Mm-hmm.
I mean, I think it's just that he gets frustrated sometimes. He can't remember things, and I think it's scary for him.
Uh-huh.
He was never, ever like this before his dementia, and those periods, well, they really don't reflect his true character.
Of course. Thanks for letting me know.
You hear an obstetrician describe a caesarean section to a pregnant patient.
Labour can progress differently for different people. In some circumstances, if labour is longer than expected, and if we detect that the baby is distressed, then we may have to consider an emergency caesarean section. It's a procedure that we perform in theatre, and it is carried out under spinal or epidural anaesthetic, so that you don't feel anything, but you will be awake. A screen is placed across your body, so you don't have to see what's being done. We make an incision in your tummy and womb, just under your bikini line to remove your baby, and then stitch up the wound. It takes around 40 minutes, and your birth partner can be there at all times. Does that make sense?
You hear a GP and his practice nurse discussing their yearly schedule.
In September, we'll have a lot of new patients, as the first-year university students will all register during freshers.
Yes, we were really run off our feet last year, weren't we?
Yep, it was a madhouse.
Do you think we should hire agency staff to help out for the first couple of weeks this time around?
Well, I think part of the problem was that last year Dr. Igwe and Nurse Fletcher were both away. Dr. Igwe went to Costa Rica and Nurse Fletcher had the flu.
Oh, right, I remember. Well, we can't do much to prevent staff illness.
No, but we can ask people to avoid booking time off in those first 3 weeks.
OK, I'll send an email out today.
You hear a nurse prepare a patient for a flu shot.
Good morning, Mr. Henderson.
Hi.
Dr. Ray has recommended that you get a flu immunisation shot before you're discharged. I've got the injection ready to give you. Are you allergic to anything?
I'm only allergic to latex and penicillin. I don't know if I want the flu shot.
Oh.
The last time I got the shot, I got sick.
I'm sorry that happened to you. What kind of symptoms did you have after that last flu shot?
I got a runny nose and a headache, and my arm felt like someone punched me.
Sometimes the flu shot can cause reactions like a sore injection site and headache. Other common symptoms include being tired, muscle and joint aches, shivering and fever. All of these symptoms can be seen with the flu, but the shot can't give you the flu.
You hear a doctor talk to a patient about her injury.
Good morning, Mrs. Bowder. I'll be your doctor taking care of your cut there. But what exactly happened?
Oh, it's embarrassing, really. You see, I was just trying to chop some tomatoes for dinner, and the knife accidentally slipped. Oh, I'm so clumsy. I hope it doesn't hurt too much to stitch back up.
Well, we're going to numb the area now with a shot of lidocaine. You'll feel a poke of the needle and a slight burn, but afterwards the area should be numb and you'll feel nothing during the procedure.
Oh, good.
We should be finished in about 10 minutes.
Good. How many stitches will I need? And how long will they have to stay in? I'm really conscious about my hands, so I hope I don't have a scar.
I will only know for sure once I finish suturing, but by my estimation, you might require at least 4 to 5 sutures.
Oh.
They'll have to stay in for 5 to 10 days, and you'll need to come back in to get them removed.
Right.
I'll do my best to try and line up the edges to create as little scarring as possible.
Thank you.
But I can't guarantee there will be nothing there.
You hear a trainee nurse asking a senior colleague about the treatment for a patient with chronic obstructive pulmonary disease, or COPD.
I haven't treated anyone with COPD before. What would we need to do differently?
One of the most important things would be to make sure to prescribe oxygen at levels between 88 to 92%.
Okay, so why would that be necessary? If he's having trouble breathing, shouldn't we prescribe higher oxygen levels? Most patients receive oxygen at levels between 94 and 98%.
Well, in healthy individuals, a rise in carbon dioxide would result in an increased drive to breathe in order to eliminate the excess gas.
Right.
However, in some patients with COPD, this response is blunted, and their main mechanism for respiratory drive is controlled by the level of oxygen in the body instead. If the level of oxygen given to a COPD patient is increased too much, it can actually reduce the stimulus to breathe and cause hypoventilation, resulting in an increase in CO2.
That is the end of part B. Now look at part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear a doctor briefing his staff about the pathology report. You now have 90 seconds to read questions 31 to 36.
Hello, Doctor. Will you please explain to me about the type of information included in a pathology report?
Well, often a pathology report of surgical specimens is complex and very long. These are divided into many subheadings. The general information includes the name of the patient, the medical report number, the date of the biopsy or surgery, and the unique number of the specimen that is assigned in the lab. The next set of information often contains patient information provided by the doctor who resected the tissue sample. This information includes the special requests made to the pathologist and the medical history. For instance, if a lymph node sample is being resected from a patient with cancer in another organ, the doctor will indicate the type of the original cancer. This is useful in guiding the pathologist's selection of special tests that may be required to assess if any cancer in that lymph node is a metastasis from the original cancer, or else a new cancer that started in the lymph node. Gross description is the next part of the information. Here, the term gross means the details seen without using a microscope, by simply looking at it and feeling the tissue sample and measuring. In the case of a small biopsy, the gross description would be a few sentences listing its colour, size, and consistency. Gross description would also include the number of tissue-containing cassettes submitted for biopsy. However, in the case of a larger biopsy or tissue specimen, for instance a mastectomy for breast cancer, this will have lengthy gross descriptions, including the size of the entire piece of tissue, size of the cancer tumour, how close the cancer tumour is to the nearest surgical margin of the specimen, how many lymph nodes were detected in the underarm area, and the particulars of the non-cancer tissues. A note of where tissue was taken from is also included. The gross description is very short for cryptology specimens. That usually notes the number of smears or slides made by the doctor. If the specimen is a body fluid, its volume and colour are indicated. Microscopic description will include details such as the appearance of cancer cells, how these cells are arranged together, and the extent of invasion to the nearby tissue in the specimen. Results of any other investigations made, such as flow cytometry, histochemical, etc., may be indicated in the microscopic description or in an exclusive section. Diagnosis is the most significant part of the pathology report. Although this is the bottom line of the pathology, this section can be mentioned at the top or bottom of the report. The doctor relies on this final diagnosis information to decide on the best treatment methodologies. In case the diagnosis is made for a cancer tumour, this section will indicate the exact type of cancer and will include the grade of cancer. Once the final diagnosis is complete, the pathologist may want to include any additional notes for the doctors taking care of the patient. Often, this comment section is used to recommend further diagnosis or to clarify a concern.
Now look at Extract 2. Extract 2. Questions 37 to 42. You hear the discussion of a physician with junior doctors on pericarditis. You now have 90 seconds to read questions 37 to 42.
Hello everyone. Now I'm going to explain to you something about pericarditis. The infection or inflammation that occurs in the pericardium is called pericarditis. Inflammation of the pericardial layers arises when the membrane gets thickened and the layers rub against each other. During such a condition, the increase in the fluid volume in the pericardial sac results in compression of the heart, which subsequently affects the functioning ability of the heart. Chest pain is the main symptom of pericarditis, which is normally not considered as a life-threatening condition, and patients may become normal in a few days or weeks. However, in certain cases, the symptoms may last for several months. It is a relatively common heart condition, and around 5% of patients with severe chest pain are diagnosed as pericarditis. Moreover, it is very common in men than in women. It affects people of all ages, but mostly occurs in young adults. Based on the symptoms and causes, pericarditis is categorized into many types. Pericarditis based on symptoms. Acute pericarditis occurs when chest pain develops suddenly, radiating to the neck, shoulders and back. The pain increases during when breathing in or inspiration and while lying down. However, it decreases while sitting. The symptoms may last for less than 3 months and may get resolved in a few days with appropriate treatment. Pericarditis may be idiopathic or due to viral or bacterial infection, cardiac arrest, metabolic disorders, or a blunt injury. The condition is also caused by radiation toxins, trauma, or as a side effect of certain drugs. Chronic pericarditis at times persists for a long period, and the symptoms last longer than 3 to 6 months. In such cases, the patient may not have the chest pain, but may experience tiredness, shortness of breath, and coughing. Chronic pericarditis is believed to be the result of certain autoimmune disorders such as lupus, scleroderma, and rheumatoid arthritis, where the antibodies produced by the body attack its own cells and tissues. Pericarditis based on causes. Constrictive pericarditis occurs when the pericarditis is associated with a thickening or scarring of the pericardial layers. This starts constricting the heart within the thoracic cavity, which in turn controls its functioning. Pericardial effusion. In a normal individual, the pericardial cavity is filled with about 20 to 50 milliliters of fluid. At times, in patients with specific medical conditions such as severe hypothyroidism or kidney failure, or in patients who have undergone invasive cardiac procedures, there may be a gradual accumulation of fluid within the pericardial cavity, which may often be asymptomatic until the surrounding structures start getting compressed. In such cases, symptoms related to such compressions such as dyspnea, nausea, fullness of the abdomen may manifest. Cardiac tamponade is caused when persistent pericardial effusion causes the pericardial fluid volume to increase up to 80 milliliters or even 200 milliliters, which can lead to malfunction of the pericardium. Therefore, this condition has to be treated as an emergency. Viral pericarditis. Viruses that can cause viral pericarditis include Coxsackie viruses, influenza virus, agents of viral enteritis, human immunodeficiency virus, and echovirus. Upon onset of this condition, the early symptom can be the infection in the upper airways. This kind of pericarditis is simple and can be handled as an outpatient procedure. Purulent pericarditis is a rare disease caused by aerobic and anaerobic bacteria. Recent studies show that procedures such as surgery in the chest region, hemodialysis, immunosuppression, and chemotherapy are dominant causes that result in this type of pericarditis. Tuberculosis pericarditis is also seen in a very minor percentage of patients having pulmonary tuberculosis. HIV patients are at a high risk of tuberculosis pericarditis. There is a gradual progression of symptoms such as night sweats, dyspnea, fever, and chill, but any suspected patient should be given emergency treatment. Radiation pericarditis is caused due to recent mediastinal radiation at any time from weeks to months after the exposure. Malignancy pericarditis is mainly caused by metastatic disease. It is common in metastatized bronchogenic or breast carcinoma, Hodgkin's disease, and lymphoma. However, it is rare in primary mesothelioma and angiosarcoma. Traumatic pericarditis. Blunt or sharp trauma causes traumatic pericarditis. Invasive cardiac procedures may also cause this type of pericarditis, which includes cardiac diagnostic catheterization and electrophysiological ablation procedure.
That is the end of part C. You now have 2 minutes to check your answers.